Hello and welcome to Bite-Sized MRCP, a manageable way to digest the things that you need to know for your MRCP exam. We are two junior doctors based in the UK who have passed all three parts of the MRCP within the last 5 years and want to help you do the same. We're not associated with any MRCP examination organizations, and the materials covered are by no means an exhaustive list of what can come up in your exam, and indeed are not intended to be used as medical advice. Please refer to your College of Entry or your friendly supervisor for further questions regarding the exam and syllabus. If you like the sound of what you hear today and would like to join us for more bite-sized revision, give us a thumbs up and press the subscribe button. Now, without further ado, let's get into today's topic, which is on coronaviruses, including COVID-19, under the section of infectious diseases. So this is a schematic of transmission of life cycle of SARS-CoV-2 causing COVID-19. I'm sure all of you are familiar with this, having gone through the pandemic yourselves, but it's quite a nice version of describing what actually happens that people become infected with this virus. So as you can see, the SARS-CoV-2 virus attaches to the cell through the ACE2 receptor and starts replicating inside the cell. This then, after infecting that particular cell, will end up being released into the systemic circulation. And simultaneously, as a result of this, you will get the virus to be ingested by the antigen presenting cell. This will then activate your immune system, including T helper cells, which will then activate your cytotoxic T cell as well as your B cells. And as a result of that, you will get that immune response that will hopefully help you fight off the infection. This, of course, will destroy the infected cells, and as a result of that will produce antibodies. And in a longer term, it will help with formation of your memory B cells and T cells, which will hopefully last for some time. And if you were to encounter the virus again, you will have the memory B cells and T cells to come and help you with the infection. The background of this is that coronaviruses are actually a large family of viruses that can cause illness in both humans and animals. They range from mild infections, and that will include, common cold, to very severe diseases such as COVID-19, or a few years before that in the UK, there was quite a large interest in Middle Eastern respiratory virus. These are envelope viruses with a positive sense single-stranded RNA genome, and it's characterized by spike proteins on the surface, giving them a crown-like appearance under the microscope, hence the name corona, which is Latin for crown. As for its epidemiology, the common human coronaviruses are endemic worldwide. They're responsible for about 10 to 30% of common colds annually. Transmission peaks in winter months, but can occur year-round. Generally, they have mild symptoms affecting all ranges, but of course, these tend to be more severe in those individuals who are immunocompromised. The severe form of this can actually cause severe acute respiratory syndrome. The first outbreak of this was described in 2002-2003, originating from China, and spread to 26 countries with over 8,000 cases and unfortunately more than 700 deaths. However, at the time, this was contained through strict public health measures with no known human cases since 2004. Now, talking about the epidemiology of Middle Eastern respiratory syndrome, or MERS, this was first identified in 2012 in Saudi Arabia, and it's endemic in the Arabian Peninsula with sporadic outbreaks in other regions. There were over 2,500 confirmed cases with more than 850 deaths. However, these were predominantly in the Middle East. The animal reservoir of this is dromedary camel, and it does not infect the camels with two humps. Now, turning to SARS-CoV-2 or COVID-19, which we're all familiar with, this was first detected in December 2019 in Wuhan, China, and WHO declared this only as a pandemic by March 2020. Unfortunately, there were over 770 million reported cases and over 7 million reported deaths globally as of April 2024. This continues to evolve with new variants coming through. You might have heard about the initial variants like Delta or Omicron and impacting transmissibility and vaccine efficacy annually. Transmission of this is through respiratory droplet, aerosols, and contact with contaminated surfaces. The risk factors will include age, comorbidities, these are especially important for SARS-CoV-2, and a state of immunosuppression. There has been many public health measures to try to reduce the mortality and morbidity associated with this, which will include vaccination, quarantine, social distancing, and hygiene practices. The animal to human transmission of SARS-CoV-2 is a known fact, and this is very similar to MERS-CoV-2. These were originated in animals and when transmitted to humans, therefore being classified as zoonotic infections. And SARS is particularly linked to civet cats, and MERS is linked to camels. And COVID-19 is believed to have originated from bats with an intermediate host. However, this is not fully confirmed. In terms of the clinical features, the mild infections will essentially look like a common cold, and you may have symptoms consistent with rhinorrhea, cough, sore throat, and low grade fever. These are normally self-limiting and will completely recover in most cases. The SARS-CoV outbreak in 2002 and 2003 were slightly more severe, and these were predominantly accompanied by fever, dry cough, dyspnea, and very frequently would progress into pneumonia. And it had approximately 9.6% or close to 10% fatality. MERS-CoV-2 that was originally presented in 2012 and has been still ongoing in the Middle East, it presented with similar symptoms. The important thing is that this had a higher fatality up to 35%. And then, of course, COVID-19, which has been present since 2019 until present, these have been having a really wide range of symptoms, ranging from being completely asymptomatic to having severe pneumonia and multi-organ failure. The fatality rate varies significantly based on age and the state of comorbidities. The management of the cases are mostly supportive, and that will include control of fever, control of pain, rest, as well as appropriate hydration. In severe cases, which were the cases with particularly COVID-19 and MERS, the patient may need to be admitted to hospital, needing oxygen therapy and ventilatory support for severe respiratory failures. Antiviral therapies have been trialed in COVID-19 as well as in MERS, and the ones that have been proven are remdesivir for COVID-19 and ribavirin for SARS and MERS. Corticosteroids are used in severe inflammatory response in COVID-19, and monoclonal antibody have also been used in those cases who meet very strict criteria and mostly will need to be cared for on intensive care units. Vaccination, of course, has been proven to be the key in terms of prevention of disease for SARS-CoV-2 or COVID-19 since 2019. So speaking of prevention, the most important element has been vaccination, which is for COVID-19 is an mRNA vaccine, which has a viral vector as well as an inactivated virus vaccine. There are no vaccines available for SARS or MERS, unfortunately, at the moment. The non-pharmaceutical interventions will include good hand hygiene, which is important in any infectious diseases, really. Mask wearing, as it is transmitted through respiratory droplets, and physical distancing and isolation of those infected individuals. There are also travel restrictions and quarantine, which used extensively during COVID-19 pandemic and earlier during SARS and MERS outbreaks globally to try to help and prevent some of these cases. Okay, let's do some questions. A 40-year-old healthcare worker presented with fever, dry cough, and shortness of breath. She recently returned from Saudi Arabia, where she did various activities, including camping in the desert and hiking with camels. On examination, she is febrile, tachypnic, and has bilateral crackles on lung auscultation. Chest X-ray reveals bilateral infiltrates. Which of the following is the most likely cause of her symptoms? The options are A, influenza virus, B, Middle East respiratory syndrome or MERS, C, respiratory syncytial virus or RSV, D, SARS-CoV-2, E, Legionella pneumonia. So technically, in real life, all of those options can be correct. However, given the fact that you're preparing for an MRCP exam, it's important to try to look for the hints on the question caveat to try to guide you to the correct option. So this is somebody who has been traveling in Saudi Arabia and she's presenting with signs and symptoms consistent with pneumonia. And therefore, the correct option is going to be B, or Middle Eastern Respiratory Syndrome. Thanks for listening to this episode of Bite Size MRCP. If you like what you heard today, give us a thumbs up and hit the like and subscribe button to make sure that you don't miss out on our next episode. Let us know in the comments which topics you would like to hear in the future. See you in the next episode.